My name is Michelle Resendez. I am the Northern Ministry Center of Hope SANE coordinator for the Northwest Indiana region facilities. Sexual Assault Nurse Examiner is the acronym for SANE. I oversee 6 facilities. Forensic nurses are specially trained nurses. They receive training for evidence identification preservation, forensic photography, forensic documentation. They really focus on trauma-informed care for victims. It's that one-on-one. When it comes to misconceptions for sexual assault, from a clinician standpoint, I would say the biggest misconception is that people believe that once they've showered or if several days have passed, that there's no evidence that's left, and so they choose not to come in to be medically treated for one, but they think that there's no evidence left. DNA testing and that sensitivity of that testing has improved over the years. We collect 5 days out, so 120 hours post-assault. So it doesn't matter how many times that they've showered or changed their clothes or ate or drank or gone to the bathroom. I think that it's important that we educate people that it's okay to come in, but more importantly to come and get taken care of. In respect to children, because I am also not only certified in adults and adolescents, but also pediatrics, I would think really talking to children and having them understand their bodies and the anatomical structures and having some comfort in talking about them, because a lot of times it seems like there's some shame that is associated with that, or they'd get in trouble if they said something. So it's just really just encouraging them to be comfortable with their bodies and talking about it. My advice for parents regarding their children, it started at an early age talking about their bodies and about sex when they start to come of age or when they suspected it or suspecting that they're going to be in that prepubescent area or you're seeing them start to go through changes. So that way they feel comfortable coming to you, and always talk about it. So that way it's, come on mom, I don't want to hear anymore. It was like, just reiterate good decision making, and I don't care what happens, please let me know if something or somebody does something to you, because more importantly, our job is to make sure that they're safe and that they're taken care of. And even when they get into the high school and even college years, I can speak as a parent myself with my children. It was like, seriously mom, are you going to talk about this? Yes I am. Just reiterate it, never stop, because you know you're giving them that opportunity when you least expect it or when they least expect it, that they may need to come to you, if it's not for them but for one of their friends. Words of wisdom to those that are in social settings like that, whether it be in high school or on a college campus, is never accept drinks from anyone who you don't know, or if it was passed across the room. If you leave your beverage, whether it be milk, soda, or alcohol, if you set it down even just for a moment, don't pick it back up and drink it, because you never know what people's motives are, or if you've been targeted and someone has been planning on or anticipating doing something to you. Sometimes people are challenged with good decision making and establishing a safe net, so to speak, or having a plan. Hey, we're going here together, this is what we need to do, and having people look out for one another. In closing, the best thing that I can say as far as relaying information to people is, when someone reports a sexual assault, just start by believing. That starts the healing process, that enables someone to reach out and we can start to help them. And also just know that there isn't any certain way that a victim reports, no certain behaviors that make them specific to sexual assault. They don't have to be crying and sobbing and hysterical. They can be normal, they could be laughing, they could be calm. There's no certain way, so when someone reports a sexual assault, just believe them.